So the adrenergic system is the autonomic nerve system, which is important in everything our bodies do. It's part of that mind-body interaction. And the research, started at Roswell Park Cancer Institute in Buffalo about 10 years ago. And it started with the investigation and observation that mice which were under stress, which were cold, they actually didn't respond to checkpoint immunotherapies at all. And it was reversed with keeping them warmer. So when the cages were warm, the mice actually responded, the immune system got better. And of course the question was, number one, what can you do in terms of people, people with cancer? And two, what do you do for animals? So number one, this led to the policy change in the whole United States that the mouth cages are now kept at the higher temperature. So that was important for research. And number two, for people, we were looking for other ways to decrease the stress. And we found out that the beta blockade, i.e. blocking the adrenergic receptor, especially with the non-selective blockers like propranolol, is actually sufficient to activate the immune system, which was suppressed by the chronic stress. And this led to one retrospective studies looking at patients treated with checkpoint inhibitors, and looking at the group which was taking beta blockers, usually for some heart issues or blood pressure issues, and also patients who were not on a beta blocker. And clearly, this is now published work, there was a better response in patients who were also taking beta blockers besides just taking the checkpoint inhibitor for their cancer, specifically melanoma. And based on that, we started a prospective trial, which is taking patients with melanoma never treated with checkpoint inhibitors, and we are combining the checkpoint inhibitor pembrolizumab with a beta blocker propranolol, and we did the dose escalation phase 1b combination, found it safe. The side effects really dictated by pembrolizumab alone, and the initial 9 patients, 7 of them had a response, but of course that can be driven by pembrolizumab. So we are now enrolling additional 55 patients among several institutions besides Roswell Park, and looking at confirmatory data, looking at biomarkers, looking at translational work, and ultimately, if the phase 2 is promising, we would like to expand, to the phase 3, probably through the cooperative group mechanism. So, it would be, one arm will be without without the beta blocker, and the other arm will be combination of checkpoint inhibitor and a beta blocker. Of course, the complicating factor is that recently we got approval of the combination immunotherapy with the LAG-3 and nivolumab. So we are actually thinking about amending the protocol and allowing the combination plus minus the propranolol as well to basically go with the times and a change in paradigm for how we treat patients with melanoma.